It's a Q&A, so I'm just like trying to be available to answer questions. Really, that's all I'm gonna do. Answer questions. Okay. So who wants to begin? Sure.
Okay. So thank you so much, Miracle, for organizing this session. I'm sure it's going to benefit each and every one of us on this meeting. So the question that has been on my mind for a very long time is how programs filter their candidates, because I'm like, okay, they say they have like a whole list of filtering list and everything, but I'm like, how do they do this? Is it the same way we filter for Amazon, or they have to open each applicant? I don't know if you get what I'm trying to say. Like,
I
if you
do.
want to buy something from Amazon and you have specifics, or you can just go to the filter and say, okay, I want something from this brand. I want something that with its price range. So
I was hoping one day I'll actually invite my PD on my channel, because he's actually like a very chill guy to talk about, like, or like how they do this thing. I saw him yesterday. I could have asked, but
so like, is it like that, or you open every applicant's application and see if actually they met the criteria for your program? So that's the question.
So far as what I know, with what I'm limited, but what I know is they are score filters. That's like the most basic filters: scores, number of attempts. I don't know if these are actual filters, but I don't know if these are actual filters, but these are things that I've heard them judge. So last year when Geographic signal at the preferencing and stuff came out, so people were like, oh, programs don't have these filters yet. Like, there are some soft filters, but there are also filters like year of graduation. There are filters like okay, so I don't know if these are objective filters, but I know that these are things they check. So as I said earlier, scores are one thing. Some people will not take people below a certain score. Some people will not take people with a certain number or if even present attempts. Some people will not take people who have graduated a certain number of years. Some people will not take people who do not have US clinical experience. Some people will not begin, not that they will never take, just that they will start from, like, because you know that people apply, thousands of people apply. So there are times when you're applying and you need to even see who should I begin to review first. Some people might choose to begin from those who have complete applications initially. Do you get what I mean? So it's like, okay, maybe that's why people are like, oh, just try to get your ECFMB certificate early. Some people use that as filters. It's not, so these are like across, because every program has like their own culture, different priorities, different things they look out for. So what is this, what this program is different for this program, right? So some people would not, and this match is very, very good. So it's like, you know how different families do different things. They cook egusi soup differently. It's literally like, I'm yet to see that, oh, this program does things the same way. Let me tell you, I had a friend that I applied like early. I had a friend who applied October ending, November. We had programs that we applied together, like same. So I have places where they reviewed his application, gave him interviews. I don't know if they reviewed mine, but I didn't get interviews. So if I now say, oh, it is how early you apply or how complete, by all standards, I should have. Do you get what I mean? So there are also people who prioritize those that have step 3. There are people who are going to prioritize those who signal them. So very different. There are people who said signaling doesn't matter for them, because let's say this is like a very popular program. And what do you think? They're going to get tons of signals from different people. So when you have tons of signals, do you think signals will do anything for you? But then if it's like a smaller program that people, like let me say, people don't really like desire that much, and then signals might matter more to those people. Do you get what I mean? So even when it comes to things as basic as signals, different programs have different ways that they say they're going to use it. So there are people who would prioritize, you signaled me because maybe we're a smaller program. So that means you have 7 signals. I know that it's different. You say, let's say you were 7 for internal medicine, you have 7 and you give me 1. That's huge. And then there's like a big program that everybody has given a signal. So that signal now becomes like lost in a sea of signals. Then there are people who will look at these things like, they might not even consider signaling initially, like they will invite who they want to invite. But I've heard someone say that potentially, like, these are like conversations, because there's no one person that makes a decision who they're interviewed. Like, it's always like a residency committee. Some people will involve their chiefs, some people will involve some program administrators, coordinators. So it's not like just the PD that's going to say, oh, you're coming. So these are conversations. So I've also heard a program director say something like, we might not use signaling like to invite you, but then that, let's say potential, and they said that it never really happens, that there are two people that have the same exact credentials, that it mostly would never happen. But that, let's say hypothetically, two people are tied and they're like, this person or this person, they said like potentially that it does not never, mostly would never happen, but let's say it happens, then you now see soft things like, okay, this person, geographic preferencing, said they want to be in this region. And then they now signal to us on top. That's like a stronger, I want to be here, than a random other person. So these things are used like it's a very moving, it has many moving parts. But these are like some of the things that I've heard people check. And of course, IMGs too. Like, some people will not take IMGs from some places, different things and different strokes from different people. My program, for example, all 9 of us are IMGs. Or like, I think in 3 classes, if you see an American graduate, like 2 people, right? It's different, like, and for all 9 of us are the same, different countries. In the 3 classes, I don't think any country is repeated twice. So people value different things. So it's very different for programs. So that's why people, like, when they're doing applications, they say, oh, try to, get the best case scenario, which is like the good skills and all of things like that. But you see people who you have better scores and they'll get interviews from programs, then you now realize that score is not what did it for them. You get what I mean? So it's like very different for different people. Yeah. And they mostly will never tell you their filters, but those things are there. And then one thing too that I know that can overcome filters is when this whole recommendation networking thing is also one thing I've seen people say. I know 2 stories. I saw those ones. One person said she was already filtered out from a program. I think it was maybe because of score or year of graduation. She's like an old grad, and 2 people actually. And then they went to a conference, just like all these family medicine or something conference, and then they met somebody, they met a PD, and then introduce yourself. It's the season. When you meet somebody, the person is likely to, and you have to realize that this is not personal. Somebody is having 4,000 applications to look through. These things become numbers. And then you now meet one of those people physically. It's an incentive to pull out the application, right? And then look beyond the scores and years and stuff. So I've seen it happen for one person. I've also seen someone else who knew someone who said, oh, okay, it's fine. I'll talk to my PD and whatever. And then they now check, and then the person has already been filtered. I think it was scores or something. And the person was now willing to review, and she was invited and she matched there. So those are like some of the ways to overcome. Like, filters are not, my point is that filters are not like a deal break. Like, it's not like, oh, because you're filtered out, you would never know. I've seen people overcome those filters. All right. So yeah. I hope that answered your question, though. I know I spoke a lot.
Yeah, I do. Thank you.
Yeah. Okay. I think we are becoming a lot, and people are not willing to put in the cameras. In 10 minutes, I will actually kick anybody out that is not, you're not participating. I said those that told me that they want to just be into this thing. But even if you're just listening, just put your camera. If you're not willing to, at least I just give 5 minutes. If you're not willing to, let's talk in the background in the DM, okay? Alrighty. Next. Any other person? Who are those that are applying? Yeah, hi.
I'm sorry that I have to request for permission for my camera to be off,
Okay.
because I'm listening and I'm also doing some other things, and
Okay.
I don't want to be some of distraction.
Yeah.
But then I have a question, like,
Okay.
regarding this filter. So one of the filters that I think I've heard about is like having US clinical experience. So how did that go for you? What's your advice on how to get a clinical experience in the US, or even attend this very important conferences so that you can have certificates and stuff like that to back up your CV?
I would defer the question to the doctor who's coming in. I didn't do US clinical experience, so I will not give the best advice. If you are like me and you know that, you've tried and it's never going to happen and you're already applying, what I did was I applied to places that said they didn't care, because genuinely there are places that don't care about your US clinical experience. So I knew that, okay, yeah, objectively was a disadvantage, but I decided that there's nothing I can do, right? Like I can't help it. This is what it is. So I applied to first places that said we don't, like, we're indifferent. And some programs, their website is different from real life, what happens behind the scenes. But at least I tried to trust that they said this, apply to those places first. Then those that said they prefer, I sprinkled in a few of those. And then if there's a program that I really liked that I just wanted to try, and then they said that they preferred, I would still like apply. I still applied, but I prioritized those that I meet the requirements for, because I didn't have money to do 200 and 150 and 120, I did 80. So if I was doing 80, that means that at least the bulk of my application should be people who I even qualify for, right?
Yeah.
So that's
Do
how
you
I
need to like pass the step 1 and 2 to do clinical experience?
You don't need step 2, but step 1, many programs that offer clinical experience require step 1. So I know step 1, yes, it's not like must, but many of them will ask for step 1 and then TOEFL or any English exam. So step 1 is always going to be like a good exam to have first before you start thinking about US clinical experience. And why I would say step 1 too is because I don't know if anybody that is in this journey kind of knows that step 1 is that the hardest path to cross. Step 1 is that exam that can take you 1 year, take you more than, Scrubby is here, hi. Just give me 1 second. So I would, me personally, this is like personal experience. When I see people who tell me that, they want to do all of these things, I ask them, have you done step 1? And I say, focus on step 1, get step 1. Like when you do step 1, your life becomes 70% easier in this journey. Just get step 1 out of the way and then start to focus on other things. Hi, Scrubby. Do you know I don't know your real name? I know.
My name is Mahati.
Oh, hi, Mahati. So she's a pediatrics resident.
Yeah.
And I just really wanted her to come on because you guys should please follow her. She shares every day about like questions, potential interview questions. She shares about US clinical experience. She shares about like this meet and greets, like everything really for the match. So please follow her on Instagram. And I know you did clinical experience and you're in pediatrics and you're another nationality. So I felt like you would have a different perspective here. So people are asking about clinical experience. So do you want to share about that?
Yeah, sure.
Okay.
So the thing with clinical experiences, I think you have to tailor it to your specialty. That's how you will get strong LOR. So for example, me, if I applied to pediatrics, I would try to get clinical experience in pediatrics. So during the match season, you would require 3 LORs. So if you can get 3 LORs in pediatrics, you don't have to do 3 separate rotations. In your whatever rotations you have 3 different providers that are willing to give you LORs for your specialty. I think that really does build a strong application, because if you're applying to, for example, pediatrics with like 3 IM letters, it doesn't make sense to why you're applying to that specialty, right? So for you, for USC, that's one of the main goals. Definitely try to get like electives when you are a student. However, for most of us, even for me, that was not the case. I came to the US after I graduated. So I was only able to do like observerships and like a little bit of hands-on externships. It wasn't too what I would say hands like I couldn't do some of the tasks that I was normally trained for. But I was able to speak with patients, interact with the parents, and sort of build I guess, assessment and plan for what to do next for the patient, but I wasn't necessarily be able to stitch them up if they needed to, put on casts if they needed to, or something like that.
So I think people want to know how to get this, right? I think that's the most common thing is how do you get this? Where did you graduate from?
So I graduated from med school in India.
Okay. And then you moved after graduation.
And then I moved after graduation. So getting UCSC is quite tricky. I know a lot of people will tell you start cold emailing programs, directors, and research people. To me personally, it did not work. I tried for 8 months trying to cold email to get a free observership or a free elective or anything like that. But to me, I was unfortunately unable to do it. I had to go through agencies because I was running out of time. So one of the agencies that I used USMLE Step, and then I used MD2B. Those were the two ones that I used. And my experience was pretty decent. I didn't have any trouble with them. I got my LORs more or less on time, and I got pretty strong LOR. So I'm not complaining about it. I know some people do have bad experiences, but for me, I didn't have any issues per se. Again, it's definitely good to try. So for example, when you see a program, especially a program with a residency, that has an attached residency, try getting in contact with like the program coordinator. You can be like, oh, so my name is so and so, and I'm a graduate, or I will be graduating. I was wondering if you guys had any observership opportunities. And if they do, some of them, in case you can get like higher up towards like any like clinical faculty, sometimes they might sponsor you to come in to do like a rotation for maybe a couple of weeks, and that could definitely help. Then again, don't fully depend on it and assume that you will get a free USE by, cold emailing, because majority of the time it's a very hit or miss. In my case, it was a complete miss. I couldn't get anything, but definitely, I mean, again, try doing it, try reaching out to programs so that they notice that, oh, this person has been mailing in. Sometimes that does help. Not now, but probably later on.
I've seen people who say it's worked for them. I've seen it's just like even in the cycle, because I'm expecting more match questions now than you guys can experience. Sorry, guys, we can have another question for those kind of things. I want like ERAS questions. But like during this season, people ask about like letters of interest, letters of intent. It's gonna work for some people. It wouldn't work for other people. So I think I was like telling them earlier that when it comes to this match, so many dynamics, like there is like no one size fits all. Another way people get US clinical experience is like going to the websites of actual like universities. So when it comes to like letters, things like that, people have different like ideas, like people have different experiences as well. But one I've also seen work for a lot of people is having like going to these websites. There are lists that fly on Reddit all the time, Facebook, USMLE groups, Instagram. People like have like this list that maybe during the cycle they've made these spreadsheets of programs that accept students or graduates for clinical experience, how much the application fees cost, what the requirements are. And for most of them, I've seen that you have to apply 6 months ahead. That's what I've seen for most of these places. And then there's like an application, and then they select you. And then when they select you, then you now go for your visa and stuff. So that's like also another potential way to get like clinical experience. I also like use an agency for virtual because I couldn't come in. I almost applied for a visa, but my mind told me I wouldn't get it. Then also because it was going to be expensive, and I was already like tight budget-wise for the application. So I opted to like just use the money to apply to programs. And because I saw people who got who matched without it, I'm like, okay, I think I can try this. So that's it. So someone raised up their hand, and as well, I think your hand has been up since. What question do you have?
Yeah, my question is really short, and then I just want to let you know there's a question in the chat as well. I just wanted to know where you wrote your step one, because I know like it's not taken in Nigeria. Was it in Ghana you wrote it?
No, I was in Germany at the time. No, I was in Ukraine at the time, so I did it in Germany. But step two, I was in Nigeria, so I did it in Ghana. So Ghana is the closest place for a Nigerian to go for. Yeah. Okay. I think someone had a match question in the chat. Okay, she said, is Residency Explorer enough for program search and Frida? And does one need to subscribe? I think it is enough, right? I used Match and Residence. Okay, so it was just easier and more streamlined for me. I don't think it's a requirement, but I wanted to try it. I don't know. Did you use any of those?
I actually didn't use anything. Well, I used Residency Explorer. Residency Explorer is free with your ERAS token. So the thing with Residency Explorer is what I like personal suggestion would be go through all the programs that you want to like. I'm sorry, can you? So I used Match a Resident. That's again, it's a free resource with your ERAS token. What you can do as a personal suggestion is go through the list of programs, and in Residency Explorer, what they have is they have the percentage of IMGs in each one. It could be non-US IMGs, US IMGs, and MDs and DOs. So for the non-US, for example, if you're a non-US IMG, you would go through the percentage listed as highest percentage to lowest percentage. And one thing that you do have to double check is programs mention that they're IMG friendly, and sometimes they're not as IMG friendly. So I would want you guys to open the program, like the program's website, and go through like the previous classes to see where their IMGs are from. Sometimes they have like one or two IMGs and they're like, oh, we're IMG friendly, but the chances you getting into that program are very, very low. So definitely go into the website and look at the previous residents, where they had graduated from. If they do have like a good mix, I think like I would say about 50-50 of IMGs and then 50-50 of like USMDs, DOs. I think that's a good mix to assume that yes, there's a chance of us matching into that program. So that's one thing you definitely have to recheck. A lot of programs say, oh, we sponsor visas, but then they take 90% US IMGs. Other programs say, oh, we take IMGs, but they only take IMGs from like Canada.
Thank you for talking about this. Anybody that has heard me talk about like program research, I sing this thing all the time. You tell me you're IMG friendly and your IMGs are from one country. You are, but not for me, right? So that's when people say program research, this is what you're doing. It's not getting the list is the easy part. All right. So I think your question was, do you have to match a resident? You don't have to. I liked it because I liked to see that people put in the chats what they thought about the programs when they interviewed and stuff. It was just helpful, right? But you don't have to. Okay. It's not like compulsory. I also use Residency Explorer. So I would arrange it like by the IMG percentage, and I had a cut of maybe 30%. Like if you're around 30%, I wouldn't look. And I still say this because finances are limited. They might not be limited for everybody. So if you're applying to everywhere, that's fine. But if you're going to have a list, then you have to have this stricter thing. So if you're 10% IMGs, yes, I know I'm special, but I'm not other special, right? So what is it about my own like application that will make me like be, but yeah. So what she said, please guys, even though they tell you that they're 50% IMGs, please go to the website. When you get to the website, the first thing you're looking at is the class. Pre-join class, 2, 3. I even did not want to apply to places where I didn't have people that look like me. Yes, in my current residency, I'm the only Nigerian, but it still works because 9 of us are like from different countries. So I know me being a Black person here is not because it's just that my program is very diverse, right? So please look at them. They're IMG friendly, but only Caribbean grads. They're IMG friendly, but only this nationality. IMG friendly, but only this. Then that might like inform some decisions that you make. So that's like really what program research is. So to answer your question, Residency Explorer is helpful. It's like the biggest database. But it was still overwhelming for me because even after I put all those percentages and everything, the list was still like very long. So I still wanted like something more. And I think before they used to have this thing where you could put in your scores and stuff, and then they compare you to the people who had matched in those programs earlier. But last year they took it away. But Match a Resident still had that. So I kind of still wanted to, have that perspective, So that's why I went ahead to pay for Match a Resident. Okay. So any other match questions?
I think someone's raised their hand.
Go ahead, just unmute and speak,
Yeah.
okay?
Hi, good. Well, everyone is in different places, so good day to everyone. But my question is, well, I think I have 3 questions. My first question is with regards to geographical preference, and I want to know your takes because I think everyone has different take on it. So I just want to hear hear what you have to say and make a decision from that.
Yeah.
Did I go ahead with my other questions that you want to answer?
I think let's do this one first. I don't
Okay.
know. Like, Scrubby, what was your biggest challenge last year when you were applying?
So to me, geographical preference helped, I
Okay.
would say. So I picked 3 areas that I liked. I didn't want to go to California. I didn't like that side. I didn't want to be in the Midwest either. My maximum Midwest was probably Texas, and that's it. I didn't want to go there. Honestly, I don't want I wanted to stay on the East Coast. So my locations were particularly like New York, New Jersey, and then like a little south, I would say like Maryland, up to like Florida, Atlanta, Georgia, somewhere there, and then Chicago. I wasn't too keen on going to Chicago, but I put Chicago. Um, and so the thing with the geographical preferences is when you pick a preference, they'll ask you to answer why you're choosing the preference. So if you have like, for example, if you have family living there, you can tell them, oh, I'm closer to my family, so I would have a support system during residency. So that could be one of your reasons. If you don't have any family there, you can be like, oh, I'm willing to explore this new culture. I'm willing to explore this area. Another thing that you could do if you don't have family there, if you have a larger population of your community, you can be like, oh, I have a larger population of my community living here, and I would feel more at home in this area. You could say that. That definitely qualifies. I know people are still conflicted on whether to put no geographical preference or put your geographical preferences. The thing with geographical preferences is that if you put a particular region, say New York, the programs in New York see that you want to be in New York, but the program in California will not see that you want to be in New York, right? So it's like saying, okay, I want to be here, but that does not mean I don't want to be somewhere else. This is my first choice, but I'm willing to go to another place. It's not my only choice. So that's I think again, personal suggestion. I think geographical preference is important to do to understand where you want to be. Again, there are so many factors that play into residency. It's not just, oh, getting into the program or getting into the specialty, because you have to work with these people these 3 years. You have to live in that city or live in that town for the next 3 years. And if you are struggling to have like, I guess, for example, accessible transport, it could be transport, accessible like benefits, like just your salary. If your salary is not sufficient for you to survive in that area because of the high cost of living, that's also going to affect how you live your life, right? It's affecting how you do your job. And we want to be in a happy, like a safe environment for us, right? Those are very important things to understand. I know many people are like, it's okay, if we match, we can match anywhere in the US, it doesn't matter. But do you really want to be living in some rural town with, quite honestly, nothing around you except like fields and all that stuff? It depends. It depends if you're a city person. It depends if you want like a slower life.
Exactly.
So these are all the things that you have to think about, because the next 3 years or 4 years, however long residency that you plan to apply to, you will be living there. And unfortunately, as IMGs, we don't have the liberty of picking everything that works for us. So we have to make some compromises, but is your living situation something that you want to compromise on? So think about that.
Yep. I mean, like, I like everything you said. I was just like, oh my God, I'm so glad like I invited you because I personally did not prefer anywhere. And I think like if you're gonna make a decision, you should have your why always. I don't know if you guys have heard anything about like people say that your application should be cohesive. Like your application should be saying the same thing everywhere, right? So what she said, if you're gonna prefer anywhere, please have a good reason. Okay. Don't like these people are going to read the application before they ever have a chance to see you. So everything you're writing should make sense. See, read every day. Like I'll wake up, I'll be sleeping, and then I just wake up. I'm like, I should have written this word. I edited my errors every second because this word sounds better, like and stuff. And maybe I obsessed, right? And you can't really help it when the sitting starts. You really can't. But please make use of everything that speaks to why you really want to be in this place. You did a rotation in this place. This is why. You have family here. You have alumni from your school. You've heard this about the place. Make everything in your CV personal. Like, for example, like talking about personal statements, people say, oh, you devote a whole paragraph to writing about like why internal medicine is the best specialty or why pediatrics or whatever is the best specialty, but why is it for you? So there is like no element of personal, like everybody, like you're talking to specialists, the PD or whoever is going to take you. These people are specialists in that field. You want to school them about their field, right? So everything in your CV should be like personal. This is my why. So I personally was also in between. Should I prefer? Should I not prefer? And I ended up not preferring. And my reason I gave them was I personally am Nigerian, have not been to the US before. Everything I know about the US is hearsay or movies and stuff. I don't have like any family, no ties. And I went to school in Ukraine, which is also like a whole different culture and everything, different language. So I told them that, see, I've been away from home for the past so and so number of years. I've learned to adapt to wherever, right? So I put it there that. So I used that space to still sell myself as someone who is resilient and adaptable, wherever it is that I am. All right. So it wasn't just to say, no, I don't have a preference. No, it's a chance to still say, this person is going to thrive anywhere, right? That, oh, I care more about where I'm going than, and stuff. So what she said, if you are like, people are very different. I personally, for one, would be even if I were to live in New York, I probably would never attend a concert or anything. I would be in my house for the 3 years. That's my personality, right? I mean, Maryland, I haven't gone anywhere, right? I went out to the mall for the first time last weekend. I'm like, oh, there are people outside, so I can say hi to people and stuff. Maryland is like very black, which is good for me, right? Very like 60% black people and stuff. So yes, I've seen myself feel better when I walk into the hospital and many of the staff are people who I can like say hi to and stuff. So what she said really makes sense. If you know that you're going to die in a rural area, if you don't live in the city, please refer to those kind of things. So what she said about compromises, there are things you're going to compromise on. So you have to decide on what are the things that are going to be like the things that are deal breakers for you and the things that are non-negotiable and the things that are negotiable. So make that decision. If you do have family, it's always going to make your residency life so much better, right? So you want to also, and some of these places, they love when people have ties to their region, then it makes sense why you want to come there, right? So if you do have family, that's like the biggest tie to any region. Please definitely prefer those places. But I've never been in the US and I genuinely did not like have any preference. So I told them that, but I didn't just put it in there. I gave them my why, adaptability, resilience, blah, 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 and stuff. And that's how. So I think, thankfully, you heard from two people who matched, one with preferencing, one without. So that's just to tell you that there's no one thing that makes you match or not match. Everything is looked at like, together, right? So what was your other question?
Yeah, so thank you very much for the responses. My second question is with regards to experiences. I wanted to know for experiences when writing like clinical experiences, how to write them to make, because sometimes I feel like with some clinical experiences, the only thing that really differentiates is like where you did it. It feels like you're mostly doing the same thing. So how do you write it where it doesn't seem like you're repeating clinical experiences, just a different location? That's my second question.
That's a good one. Okay, I don't. Now my next question will be: how many clinical experiences are you trying to include?
Well, I see people saying, I mean, I see it being said that it's good to have a higher percentage of if you have 10, for example, you should probably have maybe 4 to 3 to 2 or 5 to, so I feel like they say you should have more clinical experiences compared to like extracurricular or even volunteer, like percentage wise out of the 10.
Well, that makes
So
sense. You're applying for a clinical job, aren't you? So,
exactly. So
okay. So
that
let's say
at least
potentially or hypothetically you have 4
four.
clinical experiences, right? Like let's say you have maybe 4 clinical experiences. Are they all the same kinds of clinical experiences, like settings wise? Are they the same kind of patients that you saw? Are they the same kind of things that you did in all 4 of them?
That's not four, not between all the 4 necessarily, but between 2, or yeah, between like 2 out of the 4, kind of it
Okay.
being
Okay, so
similar, like
I'll come back to that. Maybe we can do a practical, like you tell us what those things are, and then we'll see how we can bring out some strengths or some differences from both of them. Okay. Scrubby, do you have anything?
I think the practical will help. I mean, I struggled with this too because it's a repetition of all the same thing over and over. How to phrase it is a little tricky at times, yes.
Okay. So let me see if I can pull up my CV if I still have it and see what I even included. So can you give us like examples of what are these clinical experiences that you're trying to include?
okay. Okay. So yeah. An example is like, for example, maybe a USCE outpatient setting, a clinic partly affiliated with the hospital, maybe going in for a couple of what do they call it again? Maybe going in to see the hospital a couple of times, doing like a couple of rounds. Mostly outpatient, seeing patients, general medicine patients, and some specialties, and yeah, history taking, physical examination, formulation of management, formulation of plan. Um, what else?
Okay, so the things you're doing are kind of the same, but the settings are different.
The settings are similar because both I had 2 different US clinical experiences that were both mainly outpatient.
Okay, both of them were outpatients. Okay.
Yeah.
So I I think mine was I had those 2 US clinical experiences, but they were both virtual. And then I had like an internship mini thing I did at home. And then I had this like health center, like a very rural area kind of primary health care kind of setting. So I believe that the US clinical experiences were different for me. So the things that I included. So first of all, it's not standard, but I always would start the first line with the kind of setting that it was, so that the person who is reading my CV will have an idea of the volume, the kind of healthcare setting that was. Is this a tertiary center? Is this a primary health center? Is this is it like a place that is just focused on cardiology? So I always would start giving an idea, because people, they tell you about metrics. So it's like a way for the person to know the kind of experience I would have gotten. So I would even include, or if like places where that had those kind of information, like this is like a tertiary center in the one I did in Lagos. I put it there in the largest city in Nigeria, with so number of beds. So these people will know, okay, this is the kind of place that this was. So I think that's the first thing I would say that might help to a little bit differentiate those 2 places. And I focused on just highlighting the focus of the rotation. So if this rotation was very primary care, then there's going to be so much, what does primary care focus? What's the primary care focus? Prevention. I don't know. What do primary care, what do we focus on in clinic, right? So I think it's prevention. There's a whole talk about longitudinal relationships, things like that. It's very good. It's going to be very different from what you're doing in a specialist clinic. So I would say it's not just saying that include that you did histories and stuff and you presented. So if it's an academic certain US clinical experience, then I will focus on those skills: history taking, presentation, refining assessments, learning to present and stuff. I would focus on those things. If the clinic focus was an outpatient focus, they know that the outpatient setting is very different. So I would focus on something and make it more patient-centered, right? So I think maybe you can send your CV over to me and probably would talk more and maybe give you pointers on how you could switch things around. But that's what I did. And another thing that you can do to make them stand out is all 4 of them are not going to be your meaningful experiences, right? So when you pick which of the clinical ones or how many of them are going to be your meaningful, then I would say that what you learned or what made one meaningful for you is going to be different from what's going to make the other one meaningful for you. So that's also another way to, like separate, I don't know. But in the end, I think that it's still okay. It's hospital. Hospital is never going to be very different across board, right? So it's still fine that I don't think that it's like you should give yourself the pressure to make them look extremely different, right? You shouldn't. It's fine. But maybe make one of them meaningful so you can have the chance to talk about one more than the other, and that one will set the others apart, and also like include the focus of that rotation, right? I'm sure that it's going to be different. Like when you rotate with even 2 different doctors in the same hospital, one will teach you something different, the other will teach you something different, right? You come out of rotations feeling different based on who you worked with and the kind of cases that you saw. So also leverage on those kind of things. I think those are like things that make stuff unique. You work with some doctors, they are focused on teaching. They pick your academic mind. You work with other doctors, they are focused on, like, they are so good at patient care, and you just see how they interact with patients and you're like, oh my God, I want to be this kind of person. So different, your experiences there, maybe things you do are going to be the same, but what you get out are going to be different. And I also just used to include, like, this is what I learned from the rotation. I don't think it's a bad idea. It was my CV, right? So I think those are like some of the things you can do to make them different.
All right, thank you.
Yeah, if you're applying to 2 specialties, I saw the message, please write a personal statement, because they smell these things. The
Yeah,
BDs would know.
Yeah, if you're applying to specialties that are very different, for example, internal medicine, pediatrics, you don't want to write, oh, I like treating adults, because pediatrics is not treating adults. You have to deal with adults, you have to deal with the parents, but the specialties are very, very different in terms of like disease pathology, age groups, how well you have to communicate with your patients is very, very different. So yes, 2 different if you're applying to do different specialties, you should have 2 different personal statements.
Yeah, you should. Like, I think that's the minimum you can even do, really, because you can switch up your CV. So with the things you can switch up on your LOR, so you can get and specialty specific LORs. Don't apply to a different specialty with a letter that is like 3 IM letters for pediatrics. If it's IM family medicine, you can do a mix of IM letters, family medicine, and they'll still sell because they're very primary care and like they have relationship. But if you're applying pediatrics, don't use 3 IM letters, they would know. And these days programs are saying that you kind of want people who want to be there with them, because if you notice, when people don't want to be in a place, the way they act, it shows. So they don't want to deal with people who just matched and ended up there. They want to be with people who want to be with them, right? So they're also looking at this kind of thing. So the personal statement is like the least you can do to try to sell 2 different passions. So don't use one statement, okay? And I don't know if I missed any question. 2 clinical experience. I don't think there's like a fixed number that is good. I don't think there is a fixed number that is good. It depends. How many are you going to have overall? Like, is it 5 overall? Is it 6 overall? Is it 10 overall? And if you're having 2 clinicals, what's going to be the 8? If 8 are not clinical, I don't know if that's a good balance. But if it's like 2 out of 5 or 2 out of 6, then it might not be so bad. What is a good percentage of IMGs? And when you're talking about IMGs, are you including US IMGs? I did not include US IMGs in my own, because for you to be a US IMG, that means you don't require a visa. That means you had the liberty to apply for places that don't sponsor visas, and I need a visa. So if you don't sponsor visa, I can't apply to you. So I didn't like factor those things in.
Another thing with like 4%, which specialty are you planning to apply to?
True. That's a good point. There are specialties that are going to be like, you just can't help it. There are more USMDs here, and the IMG percentages are fewer. So yeah, that makes sense. But if it's like an IMG heavy specialty like I am, then I think that's like where it
Yeah,
can hold
I am
matter.
an FM.
Yeah, oh, I am FM. Yeah. I think first, when you're even like on Residency Explorer, your first filter should be the visa. If you need a visa, your first filter should be visa. If you don't need a visa, then it makes things easier for you. Like you have like more options to choose from, and stuff. Because I think it's expensive to sponsor visa sometimes. So
Yeah.
sometimes you don't blame the programs and whatnot. And then what kind of visa, J1 or H1B, which I don't think you should bother the initial stage, honestly. Bother with it when you're doing your rank order list, but not when you're applying. Yeah. And I think there was another question in the chat.
Your 3 phrases for meaningful
Oh, how
experience.
can I phrase? Okay, let me try to say what I used. I don't know. It's personal, but I don't know. And as I said, everything we're saying here are opinions. They are not evidence-based anything. They're just opinions. So this was a virtual rotation. It was USA, it was virtual. So during that rotation, it was a good rotation. And I remember that we met like a patient who had congenital, not complete androgen sensitivity syndrome, right? And this was my first time meeting that person. And when you have people who have those kind of diseases, there's like a lot of misdiagnosis, right? There are a lot of misdiagnoses, and they end up getting diagnosed sometime like maybe when they're 20 and something. And when they tell you these stories, you see how much they had to go through before they get diagnosed and stuff. So that was like a very eye-opening experience for me, knowing that, okay, sometimes just listen to your patients. Sometimes they even know their bodies more than you do, right? So I think that was like one of the things that I took from that rotation. So I used, like what I said was, oh, I met a patient with this, and this has strengthened my commitment to patient-centered care and taught me to see the human beings behind my diagnosis. And it also taught me to know that there are going to be psychosocial factors and cultural factors to every diagnosis. We're not just treating medicine now, we're also treating people, right? And that's when when I'm making decisions, my decisions should be like patient-centered, and I should always like practice shared decision making because I'm dealing with individuals. So that's like what I phrased as what made this most meaningful for me. So the rotation in that medicine that I did back home, which I really enjoyed because this was like after medical school. It's one thing to know medicine in like textbook and then to actually see it in the hospitals. So I told and the most meaningful thing for me in that rotation were the people. The attendees were amazing, like hands down, like the best at seeing. And so my focus there was I was able to see people in this field that I love, who are going to be mentors, who are going to be people that I'm looking up to from now, like people who are exemplifying the kind of doctor I want to be. And so I mentioned the kind of doctor I want to be and say, oh, I saw it in these people, So that's like what I put there. And then the other one, I use that primary health because internal medicine, again, sometimes we do preventive medicine, right? Sometimes we do primary care, right? So I focused that, okay, this is like a community health center. And so the focus there was where I saw lots of disparities and things like that, right? So I talked about like how primary care can bridge gap for people who don't have access, how we can help them with education and stuff like that. So these are like 3 different experiences, 3 focuses, 3 meanings for me. And that's what I use as my meaningful experience. And yeah, those are the ideas I had. Anything else? If you want to add something, Scrubby, just go ahead and add whatever.
I think I have a question.
Yeah.
Are you good?
Please,
Okay.
even if you pay for any website, please, you have to go to the website. You have to go to the program website yourself. Like these websites, whichever website it is, they are giving you like tech-generated algorithms or lists. It's never going to be the same as you going to you have to do the work. I'm sorry, but you have to actually, before you apply to a place, you have to go to their website and see who are the people that are there. How do they look? Go to their Instagram, see how they talk to each other. How do their residents behave, right? what are the things that they say that are important to them? You can see those kind of things. And those are even some of the ways you don't want to apply to places that you don't fit into and waste your money, right? So you have to go to the websites of these programs. Okay, don't take any list from anywhere and just apply. You have to go there. Okay, please. Yeah, next person can go ahead.
Okay, so my question was with regards clinical experiences and dates. When you are arranging your clinical experience, did you arrange them in chronological order? That's number one. And number two, with clinical experiences, like me now, I have US clinical experience, but it was from med school, I think in 2018, 2019. How do you weigh in those experiences as compared to like experiences in Nigeria where I just had my internship like 2 years ago or like current workplace? I don't.
I will include all of them.
Okay, include all. Okay, but which one would you?
Yeah. So the software would arrange it automatically. Once you put the date, it would do it by itself. You don't have any control over that. So if there is something that you did later, like or I think it arranges it chronologically, I think, right? It puts
Yeah,
the
it is
most
chronologically
recent,
based.
yeah. So if you really want that USMLE to just come up, maybe make it meaningful. So it puts the meaningful first.
So for example, if you have 10 experiences, your top 3 will be your meaningful experiences, and the rest would be in chronological order of how you did them. That's
Yeah.
usually how it works.
Yeah.
Thank you.
So yeah, you don't have to worry about that. Just put everything, it would arrange itself. Then when you pick the meaningful ones, it would put the meaningful ones as the first 3.
Okay. And I have another. When explaining your clinical experiences, some people say do it in bullet points. Some people say write it like an essay or a narration. What's your preferred style?
I did bullet points. I thought bullet points were easier to write and easier. I mean, it looked nice. Like the appeal, the aesthetic of the application. To me, I like the bullet points. It looked nice. And the thing with bullet points is you don't have to say, I did this, I saw this, I treated this. You don't have to use half of the words and it will save you characters in order to put more information. So for example, treated children below the age of 5 in rural India, along with managing their diet, vaccination, and community environment. See how much I put in there instead of I treated so many so and so patients. I saw these things and I helped them do this.
Yeah.
So
And
how
as much as you can remove eyes, delete eyes from your application, they make things very redundant and very repetitive. Especially in your personal statement, I see a lot. Try not to use the other kind of sentence where you say this taught me this, or this. Don't say I learned this from. You get like those eyes kind of, I don't know, if you read it just somehow. And what she said, when you use bullet points, they're clearer. I've seen those 2 things too. I've seen people who do the paragraphs. If you're doing paragraphs, make sure they're interesting so that the person doesn't go overwhelmed. But bullet points are just clear. You just say it. And when you remove eyes as well, it puts emphasis on the verbs that start your sentences. So make sure you're not just going to put the same verbs. Took history. Like I've heard of, I don't know if you guys have heard of these action verbs. People recommend that, oh, you go online, look at like what are the things that instead of just saying like let me put for example, like assisting in procedures, formulating plans of care, facilitating this, leading this, things that actually like are strong verbs that look or sound positive. So it puts and more emphasis on the verbs you start your sentences with rather than I. So yeah. Okay. I think we should end in before 30 minutes because I think you have to go to work, right, Scrubby? Yes, so please. So let's take the last question. So in 20 minutes, we can wrap up.
Okay, I have a question.
Yeah.
So, in terms of applying this season, would you say it's better for your application to come in, I think September 25th, or you apply late? And I'm asking because for me, I've written my step 2. I'm currently studying this for my step 1. And now it's like, okay, I don't know, will I be ready before September 24 or do I want to like push this thing, my exam, and maybe submit my application late? Or do I still go ahead and submit without my step one? And let's see how it goes because I have my step two. That was what I was kind of asking about the filtering stuff, like how do they filter? Yeah.
So honestly, as I can answer this question better, I guess, because I've seen a lot of people come at me with this question. So the thing with IMGs is we're at a risk. We're at a disadvantage already. That the fact that one, we need visas. Two, we need there is so much we have to add to our application, not just the scores, in order for us to be able to get an interview. So applying without step one is actually a very big risk on your part because one, your application is not complete unless usually programs prefer ECMFG certified. I mean, there are exceptions to this rule. Definitely, there are people who have, applied without ECMFG certification, gotten it later, half matched. But are you willing to risk so much? Because the whole match is basically a gambling game. You don't know if you're gonna match. And even if you put your entire 100% into your application, I know people who have not matched with like scores, ECMFG certification, like good extracurriculars, good UCSC, good strong LORs, and they have not matched. So rather than have an incomplete application and sort of know that you're going into the match with an incomplete application, I think it would be better to complete everything and apply probably to the next match where you will be a stronger applicant.
Yeah, if it was last year when or 2 years ago, whatever, when Stefan was like the all in all, then it would be a big risk. How soon do you want to do step one though?
Right now, the plan is to take it to September and get my result like before application opens. But then I'm like, what if I'm not ready? That is just the what's the issue.
Yeah, so I think this is very personal because what she said about the gambling, if, for example, I've seen people ask me that can they just apply when they don't feel ready? If you have the finances to, and you think that if you don't match, you still feel like, oh, I was just trying, then that's okay. Like if what you're putting in, if it doesn't yield for you, if it will not be too devastating, go ahead, right? Either ways, you were just trying, right? And if it's like something like maybe ECFMG certification or stuff, I'm like, just go ahead. You can get that in. Who knows? I told you about my friend who applied in November and matched. It happens like a few times. And there are going to be people who are going to have everything in September. Unfortunately, will not. So there are many, like so many like moving parts. Now, the question is, if you rush through your if you rush through step one to be able to apply at the end of September, beginning of October, there are two things that can happen. You can either pass step one or you don't pass. If you don't pass step one because of the time, what would be the consequence of that on your application? And are you willing to have that? How confident are you? You take MDMAs and you think there is a good chance I'm going to do well. I would say go ahead and take it and just try, right? But if it's something like you're not even, like it's like a literal gamble that your MBMA is saying 50-50, I wouldn't take it because an attempt does so much to your application. Unfortunately, like I think that's one of the things I hate so much about like the steps is that it just stays, it never goes away. And as much as people are saying holistic, they still look at the scores. And it just messes up with, like, you might still match. I've seen people match with attempts, but the anxiety that it will cause. So it's better not to get into it than not. So if you think you have a good chance of passing in September, I would still say go ahead because applications open at the end. So you might still meet up with the first week and then you send all these letters to these programs and say, oh, I just got my step one back, blah, 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 blah. And who knows, it might yield, right? But then if it's going to mean an attempt in step one, I wouldn't do it. And then another thing is, if you don't apply, you also have to think, what am I going to be doing next year, till the next year?
Yeah, that's the main issue.
That's another big question. Okay, so let's take two more questions and wrap it up.
Okay, can I?
Oh,
Okay.
okay.
Sorry.
Yeah, go
I'm
ahead.
good. Okay, good morning. Thanks for the information you've given us. So please, I wanted to ask, so if you're applying for 2 different specialties, when you're doing the errors, you have to put like your research and your publication and your working experiences. So I don't know if you put that there, they will see that you're putting for 2 different specialties. So do you think it's something that will make it feel like somehow to feel like this guy is not playing straight?
You can't help it, right? You can't help that. But I would say that if you're going to put different experiences in your CV, make it balanced. One should not weigh more than the other. Like, don't have 9 internal medicine looking experiences and then 1 pediatrics and then apply to pediatrics. That's very fishy. But then let's say you have like a mix. I think it can still sell, right? When it comes to research, I think research is like, yes, it's best when you have like research that is focused on your specialty, which I feel like would matter so much, these like more competitive specialties, right? Those will matter. But I think for primary care specialties, we can still, research skills are transferable. So I've not seen anybody really like say, oh, her research was in pediatrics, that's why. I don't think it's that huge compared to experiences. So I think you can still fly with research, but with the experiences, if you're going to put them, make them balanced, right? And yeah, make them balanced. Don't tilt more to one side. Then if you're someone that you're applying to one specialty, right? But then it now happens that your experiences are a bit diverse, okay? But it's one specialty, you will not dwell. When you're talking about that specialty, talk about the things that still apply to your specialty of choice. And then that makes sense. So if I were applying family medicine and I had an internal medicine, funny enough, family medicine, they do everything in residency. They rotate through all specialties, but I will still make the focus something that appeals to a family medicine physician. Do you get what I mean? So I had someone who was she said she was applying ONG, but all her experiences were not ONG. In fact, she had a letter from a pediatrician. However, the pediatrician wrote in her LOR that in as much as she was taking care of like the babies, right? There was a woman who came in, like, because pediatrics also like they start from when the baby is born. And sometimes they see the moms as well. So there was a woman, I don't know the exact scenario, but there was like the ONG of that case, and there was the baby. So yes, she was taking care of the baby, but the attending saw how she managed even that woman who wasn't in her field. And the person was like, oh, it's very clear you are really passionate about obstetrics and being an obstetrician in the future, right? So that's like also how you can have an experience that is not your specialty, but you can bring out things from that experience that speak to your specialty. So it didn't matter that it was a pediatrics LOR. What mattered was that the person inside had written that this person clearly has a passion and backed it up with what she had done, even in the pediatrics rotation, that made it look like she really cared about OBGYN, right? So that's something that you should keep in mind. And then about low scores, nobody can really predict chances of the match, but I've seen everything. I've seen high scores go on match, I've seen low scores match. So, but I would say that when you are applying with factors that are beyond your control, then the things that are in your control, try to make those ones 100. That's what I would say. I knew that my disadvantage was not having USC. So I told myself that every other thing I was presenting had to be 100 over 100. So you can help what you can help. So the ones that are in your power, just go all out, and just best believe that, like, don't discount yourself because of this. It's not everybody who's like, it's not everybody who's going to like write you off because of your score. And when people are still human beings, right? And sometimes I've seen people bond over hobbies. Like, they just like that about you. So try to like sell your personality. Don't make your peers about your score. Don't make everything about your score. Still show them that there are other parts to you, right? And who knows what you would bond with somebody over.
Okay. Please, also, I want to ask.
Sorry, I think Sprague wants to say something, and then you can go ahead.
No, I was just saying I have to get to work. Is it okay if I tap out?
Yeah, go ahead. And thank you so much.
I wanted to ask a question.
Oh.
Okay.
Do you like maybe
Can
you
you-
would text on Instagram or something?
Okay,
Do you have-
yeah,
Yeah, you
I'll
could,
text
if you
you on
have a
Instagram.
question for me about pediatrics or anything that you want to ask me, definitely you can reach out. It's the same as my ID
Instagram.
name right now. Yeah, on Instagram, and I'll definitely answer those as well. Okay,
Okay.
I have to get to work. Sorry.
Thank
That's
you.
fine.
I
Thank
appreciate
you.
you being
It was
here.
very
Thank you.
nice meeting you all.
Yeah,
Thank you.
thank you.
Okay, yeah, hi. Go ahead.
Yeah, sorry. Just one last thing. I wanted to ask, so if you are applying now, is it worth it, like paying all those, there are a lot of like programs that they a lot of these websites, they help you choose your programs. Also, they help you like review your personal statements. So is it worth it using them, or is something that you can do yourself, like go through the program's websites and look for the ones that fit your requirement, and also your personal statement, you can also find a way to look through it yourself, or it's better you subscribe to all these programs that do it? Which one is best? What do you think from your own experience?
Both of them are like possible if you have like the money. It's like asking somebody, would you hire a cleaning service? If I have the money, I will hire a cleaning service. I wouldn't clean a day, right? If I had the money, I will have laundry. Like I will have my laundry picked up and delivered. But if I don't have the money, I'll go and do the laundry myself. Okay, so both of them are possible. You can find programs without a website. Just pay for your areas, go on Residency Explorer, do the hard work yourself. And even if you use a website, they can't a website will never have the personal touch that you working on your application would have. Have you seen people who go to embassies to apply and their visa or application was prepared by an agent and they don't know anything in the application? Don't be that person. Like you can use people to enhance your application, but the bulk of the work should be you. I paid someone to edit my personal statement, but I wrote it myself. Because as I said, I came into the season saying that, anything I was going to do, because I knew I really had an advantage. Its advantage, my US clinical experience didn't have to be 100, right? So I wrote my personal statements and then I paid someone to edit it. And I appreciated how, she just literally took an average PS and she elevated it. I'm not against paying for things you can afford, right? But I would say they should not, that should not mean that you should not do the work yourself. So even if you pay for a website that gives you a list, that list, I promise you, would never be like 100%. But there is no one list that is ever going to be 100% accurate because nobody can predict who would pick you. Nobody. They're only giving you chances. They are using what you've put and trying to do compatibility something, right? Which helps, especially when you're beginning and you need something that will cut down your list. So these things are supposed to be used together, not like you leave it for them, right? So that's my answer. So as I said earlier, I use Match and Residence because I liked that, okay, they even gave me, how much did I pay her? I don't remember, maybe 90 something dollars, I don't remember. I will check. I was in Nigeria. I've never met her. I just found her online. Someone said she used her and stuff. And I liked what she did. For another way to figure out these editing things is if you have a mentor, you have a senior, you have someone from your medical school, your alumni, someone you know that has matched, send 3 people, your peers, and ask them to give you input, whatever they say, right? So that's another way to have your things edited without paying is using the people in your community. Don't send to me. I've edited like 10 personal statements this year, and I'm on flaws, and I don't think I'll be able to meet up for 25th. Anyways, but that's like one way you can have your stuff edited. For my CV, I sent it to 3 people who graduated from a medical school. I sent it to them, and then they just give me inputs and stuff. I also I'll go on YouTube. I watched everything. Everything matched. That's like my whole life from my 3rd year of medical school was USMLE. So I used to be on every meeting. So I'll just be listening and whatever people say is good. So when it came to my own time, I just put those things. My CV was good enough already. Then I sent it to somebody who said, okay, can you do this like this? Can you say this? Can you add this? Can you get? So you don't have to pay if you don't have the money, right? The match is already expensive enough. So just use people in your circle. I think that's what I was saying earlier. So even when you get that list, even if you're using Match Residence, I think it's like $60 something or so. Even if you get the list, the places that they predicted are 100% for me. I didn't get interviews from those places, right? But that's just what I'm trying to tell you, that there's nobody that can predict that. They're using like data that they have, which I appreciated, that it streamlined that list for me. And the way it works, it gave me people who did not like say no to people that did not have USC, which I needed, or they've updated. I think I have like a discount code if anybody needs. So they gave me people, like I already put, I don't have US clinical experience, research, this is the number I have, graduation, this is where I finished, my medical school. So the list they gave me, so you will see that they would say people from your medical school have interviewed here, people from your medical school have matched here, people with your similar stats have this here. So I really appreciated that input when I was making my own finally. So using these things as a means to an end, not like your final. Okay. And then when people interviewed, you will see comments in each program. Oh, the PD was this, the people there were this is how they did. So it kind of gave me an idea, because yes, as much as I wanted to match, you're never going to catch me in a work environment that is bad. I'd rather stay at home, because I will never try, right? So I also wanted to like hear input from people who had been there, so. And I've advised on personal statements. I can send 2 videos that really helped me in my PS, that I think one of them is like the best video I've ever watched on personal statements. And then there's this website called BMO Consulting. They do all this PS, everything, editing for people. So their website, if you just type BMO Consulting personal statements for residency samples, you will see like a page that people have submitted, like they have put like samples of different personal statements per specialty. So you can also look at those things and see how people are writing. Like if you see any PS, they're like, oh my God, wow, this is good. You can adopt the style, not everything, So you would see, like, because it's not enough to just write like, oh, internal medicine is this, or this is why. I remember like one of the statements that stood out to me was like this anesthesiologist, this guy was applying to anesthesia. So he was saying things like about how I think he was like a part of football or a sports something. And how like when you're playing sports, it's teamwork, right? And then he now used that to relate it to how there is teamwork in anesthesia. So anesthesiologists will not be the person cutting you, but that backup that they're doing is very integral to the success of whatever surgery you have. So I think he gave an example of how he played something as something who he was never the person in the forefront, but how important that was to the game. And he used it to relate to anesthesiology. And you read and you're like, wow, this is like, so it does not have to be I was sick, my grandma was sick, I grew up in a poor. No, you don't have to do those things. You can take the things in your life that show personality and show that, oh, this like qualities of your life that are also like important for the specialty that you're applying. You can tie all those things together. Let people see you. Like when they read your statement, they should see, oh, this is this person. This is what she's passionate about. This is why she's choosing this. Don't school people about their specialty, and for the website BEMO Consulting. They have like lots of samples. So if you just type this like BEMO Consulting residency statements, like residency statements examples, I think you will see something. Then the other one, I've sent it to you in the DM. I remember the guy. I remember his name is Dr. Mirza. He was invited for this if you follow Inside the Match, they have this match summit they do every year. I also like watched the internal medicine one. Yeah, BIM academic consultant. I watched internal medicine one, and the guy came talk about PS, and I loved how he broke it down. Fun fact, after I watched that, I found him on Instagram. This guy is like an attending or something. I don't even know who he is. I texted him on Instagram. I said, hey, I watched your video on this, that. I was wondering if you could take a look at my PS. And he said, sure. I sent him my PS. He added input and sent it back to me. I'm like, wow. So you never really can tell. Just use people if you don't want to pay. Okay. So, and this is someone that I probably never met him in my life, right? So yeah. Okay, so is there any other question? Can we wrap up?
Sorry, I have one question.
Sure.
Very stupid and not related to this call, but it's regarding the step 1. Like I wanted to ask you how your experience was, how you prepared for it, if you studied alone yourself, or if you used like any, courses, or if you paid for
You
any.
have to use the word though. Like you have to use your word. So for step one, if you know that USMLE is about questions, right? So if it's an MCQ exam, the best way to prepare would be doing MCQs. And UWorld is expensive, but UWorld has happened to, like, it happens to be like the most established. It's been there over the years. It's close to the exam and whatnot. So that means that doing MCQs will be your best bet. There are people who have known who, like, maybe they studied in medical school or something. They're like, they had this curriculum that was very close to USMLE curriculum. So they can just really jump into doing UWorld and they'll be fine. Right? But if you're not that kind of person, that means you need to like now build a knowledge base. And that's now where videos come in. So those bots and beyond, I use USMLE RX. I use bots and beyond in medical school. But when it came to actual step studying, I was using USMLE RX because the videos are like same as first aid. Like it's a video resource by the authors of first aid. So you kind of follow first aid. And I liked that. I don't have to flip pages. I just follow them. It felt like someone was reading first aid to me. So I liked that. And there's also Sketchy for micro and stuff. So you can now divide your prep into phases. Like the video phase, that's what most people did. Like, so the phase where you're just building knowledge content, and then you get your UWorld and you're doing questions leading up to your exams, and then close to your exam, you're doing MBMS. My own experience is not the model because I studied for step one for many years because I was in school. So it was like something I was doing together with med school. So I can't say that, oh, this was like my start date and my end date, right? So I want to be able to like give like proper advice. It was something I was doing with school. And then 1 year, I was like, oh, this is the way we are doing it too. And then I just get you what and I start doing what. Performance is another resource that you should not sleep on. Please don't sleep on performance, okay? If you are doing step one, never, ever, ever sleep on performance. Performance is gold. It's the pathology textbook and video resource. And pathology now happens to be like 50% of step one. So it's like when you're doing pathoma, you're kind of covering 50% of the content of your actual exam. So in that way, it's very helpful. So if you can get your hands on pathoma, do pathoma. If you want to do like the videos like RX or Bot and Beyond, go ahead. If your knowledge base is like very solid that you can just get UWorld, also go ahead. But the earlier you start questions, the better. Because as I said, the exam is an MCQ question, right? So the best way is always going to be to do MCQs, right? So if you have like further step questions, just text me.
Okay, what did you say you used close to the exam?
USMLE RX. Oh, MBMs, please. Like MBMs are to like assess your knowledge now. MBMs are done by the people who do the USMLE. So it's like a practice test that if today was your exam, this is how you would do. It's very helpful.
Okay.
And then I think I've also heard that many MBM concepts are repeated. So it's also a way to, because UWorld is a question bank that is not, so when you're doing MBMs, you're doing questions that are set by the people who are in charge of step one. So you kind of know the style of questions. So when you go to the exam, you don't feel like, oh, what are they asking?
Okay. Thank you.
So 6 weeks or so to your exams, you want to start incorporating MBME so that when you do them, you also see which subjects you're weak in. So you also know how to target your last weeks of prep. Okay. And UWorld is also like good because I think UWorld has 3 self-assessments now. So you can also like piece yourself to do all 3 of them. Okay. Just to see like how you're scoring to assess like your readiness to go take the exam. Okay.
Okay. Thank you.
You're welcome. So can we go? Yeah, children. Hi.
Hi, good afternoon.
Hi.
Thank you. My question is with regards to the experiences section. I know that contributes to a major part of the CV, the experiences. So do you, first off, in terms of number, do you suggest do the whole 10 experiences? And also, how do you appropriate the types of experiences? Because I know there's clinical, volunteer. How many clinical do you suggest you can give?
How many do you have?
You said?
If I suggest 10, do you have 10?
No, I don't have 10. I have just
that's the question. How many do you have? That's what
can
you work with.
Can you include your medical school rotations there?
Did they count to your graduation?
I mean, like normal
your
medical school rotation.
Like your normal postings. Is it Nigeria Med School?
No, I didn't school in Nigeria. I schooled in Gambia. But like normal clinical rotations, is it something
So what would be the title of this thing now? Would you put your medical school? I think if you put your medical school, that counted towards your
Medical education.
yeah, I think so. Right.
Okay.
So have you
But
done like your internship and stuff?
internship, I believe, is after medical school, right?
For some people is
Yes,
before.
but I didn't do any internship after medical school. All the rotations were like before graduating here, like
So,
your
and those
clerkship.
rotations are like in med school now, you rotate through everything. So they're going to be like,
Yes.
so you're never going to have to like, you should never put all other
I see.
specialties.
Okay.
Like, what are you applying? What are you applying?
I am, and
I
maybe
am.
some.
So that means you rotated through surgery, you rotated to peds, you rotated through everything. You can never put on your CV. So that's really out. I think you can still lift your IM medical school. That still makes sense. You can include that as one, right? But then the other ones wouldn't count.
Okay.
So what
And
else do
then,
you have?
so aside that, then I did some USC in some clinics in US. I did
So how
3
how
clinics,
many? 3 clinics, and
and
then
then
so that's already
one
4.
and then one hospital.
That's
But the
5.
hospital was just for like 1 week.
That's 5, Abby.
Yeah, that can I include, even though it was just for 1 week, the hospital?
Yes, include it.
Okay, so that was about 5 clinics. So now, when you want to describe the experiences, I know they say it shouldn't be more than 700 words. What basically is it? Just the regular, or I took history, I did the exam? How do you describe those experiences?
That's what I did. That's actually what I did. So for like the clinic ones I did, my clinic was like a primary, I don't know I don't know where you're from, but health center in Nigeria is like mostly like good give vaccinations and like health center. So
Yeah,
yeah,
like doing, you take the vitals, you give vaccine, you do all those.
that's so I just put those things, and like women come there for like antenatal clinic. So I just put like, oh, I enrolled, blah 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 blah. Did like their normal checkup, monitoring, education on healthy pregnancy, like those things they do in my clinic. I put like we also used to like give them malaria IPT, right? So I put there like I did not just say I gave them IPT, I said like ensure primary prevention of diseases endemic to tropical Nigeria. Those kind of like you make it LinkedIn-ish. Educated pregnant women, like the normal hygiene you tell them, so educate, like you just make it educate pregnant women about this. Volunteered on immunization days as part of public health efforts to prevent spread of vaccine preventable diseases. So it's like a simple thing, but you make it look good.
So
And then, yeah.
like, so you go like specific details and that
Yes,
sort of.
now you put, how would they know?
Okay.
Yeah, you put specific details. Um, so like when I worked in a hospital that had like different, we consult now, we had different specialties. So I worked closely in a multi-specialty group that included this specialty, blah, 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 and that this has made me appreciate the multidisciplinariness of internal medicine, like the collaboration and stuff. Appreciated it, take care history, perform physical exam, formulate and present plan of care to my attendings, facilitate workflow, here, assist in procedures like this, those kind of things. So that's what I included. So if it's like a rotation that had like academic that you had to like present, you said, oh, you presented this case here. If you attended like rounds or grand rounds, participated in this, those just things you did, just make them presentable, write them.
Makes sense. Thank you.
You're welcome. If somebody was asking like how many depends on, that's why I can never tell you that. I use bullet points. I can never tell you to 5. If I tell you to do 10, I don't have 10. Where will you get the 10 from? So you're going to work with what you have. If you have 10, by all means, go out and put it. But if you don't have 10, you have 7, you have 6. Put them, but make them look okay. Quantity is good, but quality is more important. So just work with what you have.
Yeah,
And
that's the thing.
Yeah, work with what you have, and always going to feel like your application is not good. Other people's own are better. Everybody feels like that. Maybe not everybody, because some people might have like amazing things. But when you like see other people, especially like you're in social media and then you see people doing this and doing that, I don't think there's going to be that, oh my God, I have like the best application. But it's what you have, right? So you just try to present it the best way you can and hope for the best.
Thank you. Thank you.
You're welcome.
Lastly, in terms of like publications, is if you don't have much, maybe you just have one, and you still
Yes, I didn't have like research in the usual like sense of like the research. I just had like, you know, these presentations you do in school that like you have school conferences and stuff. So I had and I put them.
okay.
Yeah.
Thank you.
You're
Do you
welcome.
mind maybe going over if I send you like an Instagram, like just go over some of the experiences in case you want
Okay.
to.
Okay.
Thank
So my CV by all means is not perfect. When someone read my CV, the person was like, how did you get this number of interviews? Probably like a mix of everything, the CV, the peers and everything like that. So my CV is not, there's no Harvard in my CV, there's no amazingness in my CV. So I'm just gonna read what I have. Okay, so the first thing I put was this US clinical experience, the virtual one I did, because I liked the rotation. It was very academic, and that patient I mentioned I saw, it stayed with me, right? So I put that as the first thing, and I okay, actually, the thing that should have been my first would have been like the one I did in Nigeria, because I did one FMC in Nigeria that I think has been like the best, one of the best experiences I've had. Like the hospital don't even look like it's in Nigeria, right? But because of dates, this one came up first. So I put it, I described that this is like a multi-campus system that serves the healthcare needs of this area of America. Like you have to quantify, put metrics, okay? And then the grand rounds I attended, they were like in Baylor University and University of Oklahoma. It was online, but yeah, I mean, I attended the grand rounds. I put the weekly. There are some courses or modules that the woman made us do. I put the modules there. Then the cases that we discussed and coming out with plans, assessment and plans, I put it there. We had a journal club where every week we would like take like one journal. I put the journal and what we like, how we like could discuss these cases. And then I included like the presentation that I did, and I put it there, and then I put like why it was meaningful to me. Then the other one was the one I just mentioned, right? And then the second one was like the FMC in Nigeria that I mentioned, and then the health center that I mentioned. And the reason, so I tried to make the focus different. So the first focus I told you guys was like that patient. So I made it like patient-centered, right? Like, oh, this is like the kind of like this was just always teaching me. The second one, like my attendees were amazing. So I mentioned that they were role models. Like this is like the kind of internet I want to be in the future, blah blah blah. And the third one was the primary care. So I talked about disparities, talked about like dealing with people with like different health literacy levels and stuff. So you want to always like make sure that what is meaningful about it is also like interesting for your specialty. Okay. Then the other one was like the second virtual USMLE I did. I put it there. Then one was just like an organization, right? So I put my YouTube channel as well. I put it under mentorship. Okay, I put my YouTube channel. I put my why do I do what I do on YouTube, right? So there are like, at least initially, like YouTube for me was like there are not many people in Ukraine, so we had these questions and people would like DM me, and I couldn't like be there for everybody. I'm like, oh, so people don't have this information, let me start a YouTube channel. So I put it there, and I made it like people like giving back, people like this kind of things. So I put it there as mentorship, right? And I talked about like what I do on YouTube. I talked about like I had a book club, right? So we didn't have hobby session last year, but you guys have hobbies. So like, how do I let people know that my hobbies is reading? So I'm like, I had a book club when I was in Ukraine. At least I ran it twice. I talked about it. I talked about how like the community, like learning from different people, blah blah blah. Like you have to like these are normal things, but you have to present them well, right? So I talked about, because in medicine you work as a team, you work with people, okay, so and stuff. And I talked about like I was like this medical school. I was in AMSA. I was academic director. So what did I do there? What did I do for students? And what are the things that we did when I was the academic director? So I talked about it. And then the last thing I did was I talked about was I was a tutor in medical school. I included my tutoring, and then we had these church missions I used to do. I included it as well. Okay, so it's not just including things. Talk about these things. Let them hear you talk about them, right? So I still like, yes, they give you 3 spaces for meaningfulness, but you can still make these other things meaningful without giving it the tag of meaningful. So for example, when I talked about like being an academic director, so after I've seen the things I did, which are like only 3 things, like not like anything wonderful, but at least I ended it by saying that leadership challenged me to grow as a person and as part of a team. Like, so leadership has helped me to learn advocacy when you're advocating for alumni, talking to faculty and stuff. So when I talked about like the mission, I talked about like how I was able to give back to the community I grew up in, or not grew up in, like I did medical school in for 6 years, and how it just helped make my experience there better. I talked about like how I learned communication skills, having to speak in Russian and things like that. When I talked about like tutoring, internal medicine is a very medical education heavy specialty. So you're always going to have to teach somebody, even if it's not residents, it's medical students. So I still talked about that and how that's going to help me in my future. So even if they don't give you a tag to say, oh, you have only 3, you can still make your other experience meaningful by how you end it or how you talk about it, right? So that's what I did. So those are like the 3 experiences. And then the impactful experience, try not to repeat the same things that you have in your personal statements, in your impactful. Find something else that was, like, I think the character comes also like very short. So don't carry the same thing from your peers and repeat it. And then I put like the presentations, like I had like, it was mostly 4 oral presentations. It wasn't like research. So I put it there like oral presentations. And then 1 publication that I submitted for ONG one time in 40 medical schools, I put it there. So there weren't like anything huge, and they didn't even come up in my interview. At least I had 10 and it didn't come up in any of them. So maybe they were not like that impressive, but I had to put something, right? So yeah. I think that should be the last question. Okay.